This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
Do your best to select the right partner on the front end. A lot of times we use the marriage analogy in business, but I think in these integrated and strategic relationships, it's quite true. What we found was not everyone, both on the supplier side and on the provider side, is culturally ready for these kinds of relationships, and that's okay. But those initial conversations to ensure alignment of vision, mission, and values and making sure that that culture alignment exists is really critical.
Welcome to Sg2 Perspectives. I'm your host for today's episode, Jayme Zage. This is actually our inaugural episode where we are going to focus on the joint efforts between health systems and their healthcare industry partners and how they are both driving together to improve healthcare. I'm joined by two amazing guests today. First, we have Caroline Brown, the founder and principal of CDB Strategy and Advisory Services. I'm also joined by my colleague, Karlsson, who leads our life sciences and industry work here at SG2. Thank you both for being here with me today to talk about industry and provider partnerships.
Thank you, Jayme.
Thanks, Jayme. Excited to be here.
Caroline, you have got a long history in this, so I would love for us to start today with you introducing yourself to our audience and talking about how you got to where you are today and being one of those catalysts to make these partnerships active.
Thanks so much, Jayme and Karl and the SG2 team. I have an interesting winding career background, so I'll tell a little bit about my story and how I landed where I am today, where essentially I serve as a partner for companies that want to strategically grow and try and figure out how to work differently with provider organizations and health systems. The supplier-provider relationship is something I'm extremely passionate about because of the impact it can have on transforming the healthcare ecosystem. But I actually started my career straight out of undergraduate doing strategy consulting for federal elected officials. I worked on presidential campaigns and congressional races and U.S. Senate races. And I learned a lot about the broader economy in the U.S. and how politics and government intersects with industry, which is very relevant right now. There's a lot going on that drives impact there today. I spent about 8 years in that world, and then I made a hard pivot into healthcare, got my MBA, and I worked at a large comprehensive academic medical center for about 9 years in a variety of roles. But when I left the organization, I was the chief strategy officer, and I oversaw our strategic partnerships and joint ventures with industry and other peer organizations, as well as the kind of standard business development and strategic planning function that many health systems have. I'm really excited to share some insights from that time at my previous provider organization and a little bit about how I think industry and providers can work together more seamlessly and effectively to drive change.
So you've spent a lot of time working on these partnerships and you're being very humble. I think you were one of the trailblazers in this space as a chief strategy officer, really pushing on what those partnerships with industry could do. What was the rationale for you investing your time and effort and resources and that of your team in these types of partnerships?
These kinds of integrated relationships can feel risky for organizations that have traditionally had client-vendor arrangements. You have to understand the why. From a provider organization perspective, we're constantly looking for more predictable impact from a financial perspective and having a little bit more stability on what cost is going to look like through some of these vendor arrangements. So that was one major driver. The other is aligned incentives. As healthcare goes to more value-based care and we get more aligned on ensuring patient experience and patient outcomes is the North Star, it really helps for industry and provider organizations to be working towards common goals together. When you have a service being deployed within your system, if it's not helping you drive the KPIs that, number one, make your business better as a provider organization, but number two, drive patient outcomes, then what value is that vendor really providing? We were looking for an opportunity to innovate, but not have to do it by ourselves and to do it alongside folks that had resources and an understanding of healthcare and the healthcare ecosystem from a unique and diverse perspective than those of us that worked within provider organizations. That was the drive for us. How can we drive innovation? How can we align incentives and goals? And then how do we mitigate some of the financial ups and downs that we're all dealing with?
I think Caroline is raising a couple of really important points. This is not just about innovation and kind of improving outcomes. This is also about the longer term partnerships and creating stability on potential price changes. A lot of the conversations fall short because it's always a discussion about what's the price negotiation versus how could we potentially partner to create more stability and visibility into the spend over the next couple of years in some of our major categories. And that should be beneficial for all parties involved. It will help our providers understand how to budget for some of their big expenses, but also it's helping all our industry partners get better visibility on what is their expected revenue over the coming years. So there is a strong argument there as well. It goes beyond just a 1-year price for the contract.
That's an excellent point, Karl. In a lot of our deals, we used to say we want tomorrow's technology at today's price. In other words, we want to grow with you as an industry partner. Prices only go up generally. That's usually how it works. So we want stable pricing for a long range commitment to using your product or service. And in exchange, you know exactly what revenue you're getting from us every year. And by the way, that probably means you have to deploy fewer sales resources for an extended period of time, which, as we know, for a lot of med tech, pharma, and life science companies, cost of Salesforce is one of your biggest costs and certainly something that the C-suite is evaluating.
And access to a partner to test out that value proposition, then build real world evidence and get access to clinical champions. That is huge value, especially as more and more products are coming to market faster and faster.
Karl, you work a lot with our industry supplier clients across a lot of different segments, pharmaceuticals, med tech, med supply. You're seeing an increased interest on their side, but also on the provider side in these partnerships. How has that evolved over the last 5, 6, 7 years?
It's evolved, maybe not at the speed that we were hoping, because this is not easy to do. But our industry partners are realizing they need a faster way to demonstrate their value around the products, their solutions, and their services. At the same time, our providers are recognizing that they cannot do all this innovation themselves, and they need partners to make sure they most effectively achieve outcomes, find the right protocols, educate staff around those protocols, and get to the best possible outcomes. We're seeing a lot of interest on both sides, more so than we've seen historically, which is what we predicted a couple of years ago. We're still seeing some of the challenges around how do we put the right governance in place? How do we overcome the barriers of legacy trust? How do we involve some form of risk in our partnerships? The area that we have solved for is how do we find the right sources to kind of measure and define outcomes? And whether that's clinical outcomes or whether that's operational measures or cost measures. We're in a really exciting time. The challenge is, just from an overall margin perspective, on the provider and on the industry side, is forcing new creativity and driving some of these partnerships at big scale, but also at local and smaller scale.
Let's talk about the complexities of these strategic or even integrated partnerships. Caroline, they require significant investment. What are some of the biggest challenges that need to be overcome, and what are some of the resources that you need to have in place to make them successful?
Long-term arrangements that are meant to drive change and shift in outcomes are going to require more hands-on management than a traditional vendor-client relationship. You have to go into it on the industry and provider side, knowing and understanding that. I was really fortunate to be a part of an organization that believed in this so much that we were able to build out a function as a part of our strategy team to manage these relationships in an effective way. Not every provider organization can do that or should prioritize that depending on what their strategy is. However, oftentimes there are resources that already exist within a hospital or a health system, whether it's in operations or project management, program management, other things, where you can find some dedicated resources that help with the day-to-day operations of this more integrated approach. However, the most important thing in terms of resources is the time of your executive team. These integrated and strategic relationships are not effective if you don't have joint governance. And what that means is that there's essentially some type of board or committee or group made up of executives from industry partner or supplier, as well as the provider organization, that is really steering the strategic direction of the partnership, ensuring that it's hitting its joint KPIs. Certainly, we recommend that all of these have shared risk and shared reward, which means there's dollars and cents tied to it. And anytime money is involved, things can get sticky. So it becomes really important that you have that engaged group of executives overseeing the relationship and helping the team manage through any conflict or challenges that pop up, because they sure are too. From a resource perspective, you got to have engaged and bought in executives. And I think you've got to have some level of project, program, and relationship management.
There's a bit of matchmaking going on here. You have to find the right parties, the right industry partner, and the right health system that is willing to sit at the table and actually explore some of these conversations. That's one step, and not everybody will be ready on the industry side and on the providers. So I think that's an important first step. Secondarily, an open and honest discussion about what do we focus on? What is the most important strategic problem that we're going after? And ideally, that will be a big problem, but something that's executable through the partnership. A challenge sometimes on the industry side is a lack of listening to the needs of the customer. Sometimes it is the need to have a conversation about what are the 5 possible areas where we might only find 2 or 3 of those that we can actually go after. Avoidable admissions, or hospital-acquired conditions, or readmissions, or maybe it's something more operationally related to length of stay. It's important to line on that. And it could also be bigger, like enterprise goals, 3 years, 10-year horizon. Finding the right partners and looking at that, figuring out what strategic problem I'm going to go after. And I think as we did some of the surveys of our providers, knowing where should we focus our strategic partnership, we don't know what problem we're solving for. That's a perfect example where we sit down at the table and discuss that together. On the how do we do this, beyond just the governance, which is probably the number one, can we align on how we share data and how we create a process in place where we can creatively set up the right outcomes measures, monitor those, and have some flexibility in terms of how we measure the performance of the partnership.
Those KPIs and being able to establish them requires having shared data. That's a good call out, Karl. I'm going to move on now to what makes them most successful. And I think you alluded to this a little bit, Caroline, in the idea that this has got to be a team, a governance structure. How do you do that ongoing management? What do they need to do as that partnership matures to continue to get the results they're striving for?
The first point is do your best to select the right partner on the front end. A lot of times we use the marriage analogy in business, but I think in these integrated and strategic relationships, it's quite true. Not everyone, both on the supplier side and on the provider side, is culturally ready for these kinds of relationships, and that's okay. Those initial conversations to ensure alignment of vision, mission, and values, and making sure that that culture alignment exists is critical, because when the going gets tough, and it's going to, you at least can lean back on that as kind of your North Star. So spending a lot of time with that selection process is important. We went through a process of looking at our existing vendor relationship and saying, where do we have significant buying power? And we're spending a lot of our hard-earned dollars. And then also, which of those organizations do we feel like are cutting edge or market leaders or going to be doing really innovative work going into the future? We might want to hitch our wagon to them. And then we did very intensive in-person, on-site meetings with folks to really understand whether they had what it took to take this new approach. And at the time we were doing it, it was truly globally unique. We were charting new territory together. The other big thing is this concept of evolution, and that these arrangements are longer term. I recommend if you're going to do a strategic partnership, depending on the type of supplier, it's at minimum going to be 3 years. But in our case, we were pushing into some that were 5, 7, 10 years long. You have to create an operating system within the partnership that has the appropriate structure to make decisions and also to pivot when something's not working. And you have to have that commitment to evolution, because 10 years ago, we were in a completely different health ecosystem than we are today. And so certainly if you signed a contract today for 10 years out, things would be very different. So making sure you have that balance of structure and discipline to manage the partnership in an appropriate manner, but then also have the wherewithal and the trust between the two organizations to say, time out, this isn't working well, we need to try something different. Or, by the way, this is a new strategic priority for the organization. How do you guys help us achieve our goals faster in that new space that we couldn't have possibly predicted when we signed up to do this together?
Karl, from your perspective, with some of the partnerships that you've been involved in, and actually, Caroline, I know as you're strategically advising a number of organizations, I'd love to hear from each of you. What is some of the most unique approach with some of the partnerships you've seen come together?
I'm always impressed when executive level folks on both sides are sitting at the table to really brainstorm possible partnerships. This is an important part of that, using the marriage analogy, finding the right partner. If executives from both the industry side and the health system are showing up to sit down and take time and meet, that signals to all parties involved in both organizations that we're serious about this partnership and it's going to get the right support and the resources. Those are always the ones that impress me, Jayme, because the executive's time is limited, and if they're willing to sit at the table, have this discussion, it's a serious partnership. In contrast, if it's being done in a pocket within the organization, there are challenges around this. I'm always impressed by the ones that are future focused and looking at not just the next 12 months, but actually looking at the next 3 to 10 years to truly find hundreds of millions in cost savings and actually committing to that and building a roadmap and dedicating teams and resources, and then creatively exploring ways of getting to those cost savings. This is signaling a move towards more risk-based type of partnerships between industry and providers, which there's still a lot of opportunity there. So most of the partnerships on that side has been between payers and health systems or payers and manufacturers. This is the most exciting space. There's a lot of expertise and knowledge that can be shared to truly bend the cost curve overall for healthcare. So just enormous opportunities there across the board.
I know that a supplier is serious about these relationships when they do two things. Number one, want to fully understand the provider organization's strategy and where they're trying to go and how their product or service can help them get there faster. It's not just merely listening as a salesperson. It's asking the right questions about the organizational vision and aspirations and trying to figure out how you can drive value there. And so if you can truly align to components of the provider organization's strategic plan that they're already trying to drive, that their board has already endorsed and signed off on, that in some cases their shareholders are happy about, then that to me shows you're not only listening, but you're able to apply your product or service in a way that's valuable to the organization. For provider organizations, supplier can tell that the provider is serious about this when the provider is willing to share in the reward. What I mean by that is it's becoming more and more common that vendors are providing some type of at-risk compensation. In other words, if they don't hit certain goals or metrics, then maybe they don't get paid. And that's certainly a step in the right direction. The most unique arrangements across the globe are ones where when you exceed those targets and you're overperforming together and you're succeeding together, how do you share in that financial reward? And the organizations that are willing to not just share on the risk side, but also share the upside are doing the most unique and impactful work. There's a lot of discussion happening right now at the national level about large consulting firms and the kind of bloated contracts that folks have been paying for years to get somewhat canned strategies and that kind of thing. I think there's value there sometimes, but sometimes not. It's an opening for supplier organizations to think about their businesses differently. How can you bring deep subject matter expertise to health systems in particular areas, whether it's radiology or path and lab or cardiology, depending on whatever product or service you provide, and bring advisory services alongside that? Because more and more provider organizations are going to want less of the big canned strategy from large consulting firms and more of the practical, tactical ways to do things like drive throughput, increase revenue streams, get waste and cost out, run more efficiently. That's the kind of value I think that companies in certain verticals can really bring rather than this broad scale list of recommendations. There's an opportunity as this consulting market evolves for more and more life science companies to get a piece of that subject matter expertise advisory service work.
That's awesome.
There is an information gap between our providers and our industry partners, our suppliers. Our industry partners sit on an enormous amount of knowledge about what is the clinical value proposition related to our products, but they also understand what's the ideal use of the product, both where is it underused or where is it overused. And that's truly a clinical partner that can help optimize utilization, put protocols in place to both increase utilization, say for vaccines, or appropriately lower utilization for overuse of certain imaging studies, for example. There's such a unique opportunity to leverage that knowledge and that experience that sits with our industry partners in better achieving ultimate superior outcomes. The other measure here is, are we truly talking about a contract cost savings, or are we thinking about how we can improve the outcomes of a certain patient population? Because if that conversation is not happening, we're somewhat missing the benefits of these partnerships.
The flip side of that, Karl, is on the industry partner side, by working with a provider more closely, they can understand how their products are actually being used, which may not necessarily been how they were designed to be used. And that could lead to some innovation in that product that makes it easier to use, more efficient, those types of things. So it's a two-way knowledge gain there. I want to make sure we leave our audience with a little bit of advice on how to move forward. If they haven't embarked on these types of partnerships, what piece of advice, Caroline, would you give them to get started, both from a provider as well as a supplier perspective?
For our supplier friends, this can be hard to do, but y'all need to spend some time making sure that you can provide predictable impact, align your incentives, and speak the language of the C-suite of provider organizations. And that takes time and getting to know your customers in a new and more intimate way. So highly recommend doing that and spending more time with customers and asking them what their strategy is and where they're headed and how you may be able to help. For provider organizations, this work is not easy and it can be resource intensive in a time when everyone is stretched from a bandwidth perspective and there's 1,000 fires to put out and a new crisis every morning when you turn on the news. It can be tough. The provider organizations that invest in innovation and doing things differently and capitalizing on all of the resources that exist within these private sector companies are going to win the day. I would highly encourage you to think differently about your vendors. Don't think about them as someone who's there to serve you and you can bark at. Think about them as a strategic partner that can help you drive your business and achieve your goals.
For industry partners, take the time to understand your customers and how your different customers have different needs. That's really important. And this is often missed, but this gets back to Caroline's point about, do you understand your customer strategy? Do you know where they have pain points, where you might be able to solve problems? In addition to that, understanding the market trends related to the product category and the disease state to be able to see, where is the market moving? If a lot of our procedures are shifting outpatient, what does that mean for a potential partnership? Or if we're seeing a higher admission of more acute, sicker, comorbid patients, what can we do to help there? Understand the customer, understand the market. For providers, this is about being willing to take risk and entering into new type of partnerships, but making sure you involve all the stakeholders. This is not just some conversation with supply chain. This needs to be the right clinical champions. You need to have the right administrative leaders, maybe service line leaders involved in some of these partnerships. Providers will sometimes struggle with, they might have too many of these partnerships. Jayme, we're seeing in our survey, there's more and more of these partnerships coming up, and that's challenging to manage. And you almost need to decide, we're going to focus on 3 or so partnerships over a defined period of time and learn from those before we decide to scale. This is from a provider perspective, focus and make sure you can learn from these initial partnerships. I genuinely do believe that this will be a competitive advantage, both for our suppliers and for our providers. This will help the providers truly differentiate themselves in their market in terms of achieving superior outcomes, standardizing protocols, improving operational efficiencies, and ultimately lowering total cost of care. For the suppliers, this is creating long-term relationships, which creates lower SG&A costs and a better visibility into future revenue, and also advancing the clinical value proposition and learning from those partnerships. This will be the path to the future from a differentiation perspective for both entities.
And we've been talking at SG2 about the need to differentiate. So that's a great way to close our episode for today. Caroline, Karl, thank you so much for joining me today. And thank you to our listeners, as always, for joining us on SG2 Perspectives.
Thanks for listening. If you like this episode, please subscribe, rate, and review us, and or follow us on Twitter and LinkedIn at SG2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, SG2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You can find them at Vizient /podcasts. Have a great day.